Dr. Angela, I'm so excited to have you on. So, why don't you start us off by sharing a little bit about how and why you got into supporting women that are facing PCOS?
Oh, yes, that's good because here's the thing, Roseanne, is that I have been a doctor for 10 years now. And a few years back, all of a sudden, all these women were coming to me talking about a very similar story where they were saying, I have been to my other doctor. I've got PCOS. I'm trying to get pregnant. And they're telling me that my labs are fine. And yet I'm here. I still have irregular cycles. I'm not pregnant yet. I'm not ovulating. And they tell me that IVF is the only answer. And to them, they were like, I'm not ready to jump to IVF. They wanted to see if there were other answers out there. They didn't know. And so then that led them to me. And I'm like, yes, there are so many answers out there. Okay. And these women, I would hear stories, I still do, right, to this day, of women feeling broken, particularly because they were getting this dismissive advice from their doctors of just, oh, go lose weight, or, everything's fine. Like, we can't figure it out. Good luck. Or, just try this medication again, or go back on birth control. They tried that, didn't work for them. And so just they're left feeling heartbroken and like it's their fault and that their body's broken. And what needed to happen is just some more clarity on their specific needs. And so I started helping them with that. That's how I developed my PCOS fertility protocol, and have just ever since then been helping all these women to understand, get really clear on their PCOS, what's keeping them from getting pregnant, getting to that root cause, even when they've been told that their labs are fine, and then getting set up on this path to success for optimal fertility.
Well, and so let's back up the bus a little bit, because for the women listening who are not diagnosed with PCOS, or at least not yet, or maybe they were told it was a non-issue, what is PCOS?
So PCOS is polycystic ovarian syndrome. It's one of the top causes of infertility, of female infertility. And it shows up in the body basically as irregular cycles, long cycles. Maybe someone only has one cycle a year, but for someone who has a cycle, a period, every 45 days, they could have PCOS. Some other really common symptoms are like chin hair or back hair, hair where you don't really want it, easy weight gain, acne, particularly around the chin. Those are all some classic signs that somebody has PCOS.
And so what are some of the tools that are used to diagnose it, other than like recognizing some of those symptoms? Are there specific tools that are used?
And diagnosis is really important for PCOS because it's a syndrome. And a syndrome is a set of different symptoms that create this syndrome. Okay. So PCOS, for the diagnosis, there are 3 different pieces of criteria. You have to fall into 2 out of those 3 in order to be diagnosed. That means that your PCOS could be very different from your friends and from anyone else who's in my community, because your 2 symptoms creating your PCOS are different. And so it's important to get that really clear foundation of what it is that's creating your PCOS diagnosis. Now, some doctors will diagnose it just based off of the symptoms, like we just talked about. And other doctors will do actual testing to understand exactly what your hormones are doing. They will look at your testosterone levels. Those are we call them more the male dominant hormones, because they're typically higher in a person with male hormones than somebody with female hormones. We don't want a lot of testosterone. So we'll test for that because that's part of the diagnosis, elevated testosterone. You can also get an ultrasound to look at your ovaries. The interesting part about PCOS is that you could have PCOS and not have any cysts on your ovaries. because having cysts on the ovaries is just one of those pieces of criteria in that 3-part diagnosis. So you could have the elevated androgens and ovulation issues and not have any cysts on the ovaries and still have PCOS.
Well, and that's interesting because people might think, well, it's polycystic ovarian syndrome, so I must have cysts.
Exactly. Yeah. So that's a big misnomer with PCOS. So if you go in and get a pelvic ultrasound and it's clear, you cannot write off PCOS.
Okay. Okay. Well, and so typically when women come to you, is it because they're noticing those symptoms? Like, is that typically how it all starts? Like a woman will either be trying to conceive or maybe, is not ready to conceive yet, but she starts to notice long periods, missed periods, facial hair or things like that. Is that typically how somebody comes to you?
I'll tell you this, Roseanne. Actually, women will come to me who they know that they have PCOS and they have been trying to get pregnant for years, like 7 years.
So it's fertility that's typically the signal. Okay. Well, and that's interesting because like we all kind of get there in different ways. So I was kind of curious about that. Okay. So fertility is the way. Up to 7 years you've seen. Wow.
Yeah. And so they're coming to see me and they've been to multiple other doctors and they're just usually getting that dismissive advice. They're being told that their labs are fine or that it's their fault, that if only they could lose weight, if only they could lose X amount of pounds, then their fertility will open up. Like literally doctors are giving this kind of information to their patients, to these women with PCOS.
Dr. Angela, like what is going on here? Like, I mean, I think this is, and I'm so happy that you're raising this because, so many women out there who have not been to medical school or have been raised to not question people in white coats. Like the idea that, somebody might not be giving you all the information and it's not intentional, it's just what they know, right? People will use the information that they have, but somebody like you has more information.
Yeah. So different doctors have different toolboxes. And many conventional doctors will have, well, I'll preface that I'm a functional medicine doctor. Okay. So I'm trained in using medicines, but I use nutrition, so much more. Okay. So conventional medicine doctors who have their toolbox of medications and they use that fertility algorithm to treat women and to provide this fertility plan. They're using that model that the symptom has one treatment that will fix this one symptom. Okay. So that's so often this thought process in medicine. In so many instances, that is beautiful, right? If you break your arm, you want to go to the doctor and get some pain medicine for that. And so, yes, we need that, but fertility is trickier than that. And particularly with PCOS, because as we talked about, PCOS is that syndrome. It's made up of different symptoms. So if you have PCOS and you are headed in to talk with your doctor, and your doctor has that hat on of having that like tunnel vision of, I want to give you a medication that's going to fix everything that's going on with you. That doctor, their intention is very good. They want to help you, but there's a misstep there because we know that with PCOS, there is not one pill that's going to fix everything that's setting up your body to keep it from getting pregnant. We know that because everyone would be pregnant right now who wanted to be, if that were the case, right? And that's not happening.
Right. Wow. I love that you're on this track because I think that so many women have felt disempowered, confused, left behind, abandoned by a system that they were led to believe had all the answers. But I think that there's a growing consciousness in the fertility community, and I think across the board as far as health is concerned, that people are demanding root cause answers rather than just take this pill. I mean, I saw something recently where I think there was like some insane percentage of adults have chronic disease by the time they're 40 with multiple prescriptions. And people just tolerate that rather than getting to the root cause, which, there's such a shift in the medical community now that there are some, rebels. I say that with so much love, some people, overturning the apple cart to say, no, we are not going to use an algorithm. We are going to go back to treating humans with humanity. What do you think?
Roseanne, I am so glad that you used that phrase, root cause, because over and over, I'm hearing this from the women when they first start talking with me. They're using that phrase. They want to get to the root cause of their fertility struggles. And because, again, they've been trying to get pregnant for years. And that, whatever medications they've tried so far, it's not working. And more than that, they feel in their body that something is not right. And they'll tell me, I see pregnancy in my future. I want to get pregnant. That is the goal. But you know what? I am a little nervous if I were to get pregnant right now because my periods are all over the place. I haven't had a period in the past 4 months. I, have had a cold for the past 6 weeks that I haven't been able to kick. And so there's this element of like, if I were to get pregnant, is my body healthy enough to hold that pregnancy and to have a healthy baby? And so these women, there's just a huge amount of women who are saying, no, like, I don't want just a pill that's going to supposedly take care of everything. Because one, I already know, I've already tried that. It doesn't work. And then two, I want to get to this root cause of what's keeping me from having regular periods. I want to address that so that my periods are regular. I'm starting to ovulate naturally on my own. And guess what? And I feel healthy in my body. I feel really good and juicy. There's all this vitality running through me because I want to be healthy for my life, for who I am as a human being. And I also want that healthy pregnancy and a healthy baby. So, even though these women have been trying for the past few years to get pregnant, they have to put kind of just a hold and say, yes, I've got this long-term plan in mind. I know it takes a little bit more time, but I know that the benefits and the outcome far outweigh, that time that I'm going to put into this.
I love that you're taking that position because I think that one of the downsides to more conventional medicine is we've been conditioned to believe, oh, we'll just take a pill and solve the problem, right? As opposed to taking personal responsibility and becoming our own advocates to really go into something, with our physician as a partnership and say, hey, if we want to get to the root cause, it probably is going to take a little bit more time. It might take a little bit more investigation. And we might have to do more diagnostic testing. We might have to look in places most people don't. And I think that, at first, some people, like, I run into this all the time in my own practice where women are like, it's taking so long. And it's like, wait a minute. This isn't just about getting pregnant. It's about staying pregnant. It's about becoming the mom that you actually want to be and living a healthy, full life for this family that you're working so hard to bring here. I mean, I think it's so refreshing, Dr. Angela, like what you're talking about here, because, just energetically, people can feel your approach is different, right? It's like, we just want to hug you, and when we think about somebody being really invested in seeing her patients through for overall health, for mom, baby, and the family. That kind of approach, Dr. Angela, is literally changing family trees and empowering people way down the line because grandma had, me or your patient is grandma down the road. Yes. Like grandma had the guts to ask some daring questions like, what's the root cause?
Yes, that is so powerful. And you're going to see those positive effects in so many other ways, with more energy, more, less mood swings, better sleep. Like, it's just, fertility is whole body health. And that's such an important mindset switch to get into, as exactly you were saying, away from that, well, just one pill is going to fix it. But that also brings up a really important point, that I'm also not saying that medications don't have their time and place, right? Like, the problem is that so many women who want to get pregnant are being recommended those medications right away as, okay, oh, you've struggled, it's been a few months or a year or two, you haven't gotten pregnant, here's this medication. That's, not, in my opinion, not the best way to start. You really want to get that foundational fertility environment in the body, do that work to figure out the root cause, get, your hormones in line, egg quality nutrients supported, inflammation low, all of these elements that I work on in my PCOS fertility protocol, get those in place. And then sometimes, honestly, with PCOS, getting one of those ovulation induction medications is important. And it's just like, it just pushes you over the line at that point. And it's like that key in the lock. So sometimes those medications are really brilliant. I mean, we live in this world that has amazing advancements in medicine, and thank goodness that they're there for families that need them. And that is what it takes. But it's important to not have that mindset of the pill, or whatever pill it is that you're being recommended, or medication or therapy, that's the only thing that's going to make the switch. No, your body is one beautiful system. All of the, your organs are talking to one another. Your hormones are all talking to one another. Your brain is talking to your ovaries. I mean, it's all one system. And you've got to be working with a doctor who understands how to look at those different systems, rather than just staying hyper focused on that tunnel vision with the, getting that egg out of the ovary. That's missing a big point in the fertility world.
Yeah, I mean, I think that's so smart. And I think that what that does is set women up to have their own authority on this journey, because like two things can be true at the same time, right? I mean, yes, you may have to use some medications. That's great. But when you build up your baseline health and you're addressing, metabolic issues, other things that are going on with you, not only can that help that medication work, eventually the goal is to make it obsolete, so that you can, you're not constantly on a lifetime of medications if it's not entirely necessary. So,
Absolutely.
So I would love it if you would share a little bit about, because unquestionably women are going to hear this and like start beating your door down. But, typically when you start working with women, what are some of the places that you look? Let's say if a woman has this diagnosis, comes to Dr. Angela, like what are some of the first steps that you take?
The first step is getting clarity. So when women are working with me, one strong value in my practice is giving individualized support. Because again, with PCOS, one size fits all approach does not work. Okay, so we've got to get dialed in on this person in front of me. What is going on in her body? And usually I will say maybe one patient in the last 5 months has come in with the amount of labs that I want to be seeing to understand this holistic picture of what's going on in her body. So we are running labs first thing to get that clear picture of, inflammation, thyroid, blood sugar, hormones, this nice picture of what's going on. And then step by step, based on symptoms, based on, medical history, what's going on, we have to walk through that PCOS fertility protocol to figure out, okay, today we're talking about egg quality. Everyone has got to talk about egg quality. What's going on for you, and what kind of level support does your body need to provide your eggs with the nutrients so that they're ready to go ovulate and make you a baby, right? we've got to talk about gut health. What's coming up for you in your gut? Is it creating a lot of inflammation that's then, say you are getting pregnant, but all that inflammation in the body is pushing that fertilized egg out. And it was all the way back the line in your gut health. And gut health is not commonly talked about in a, primary care office or an OBG office. Some are, that's awesome, but it's not all the time. And so is that getting missed? We've got to cover those things. And so it is 100% getting that clarity on what's coming up on the body, and then what's necessary for each person's individualized needs.
So that would seem to me that once you get all those labs and you're sitting and talking with somebody, that you can create a plan. This is the protocol that you're talking about that's individualized. And it sounds to me like that would include nutrition, perhaps medication or supplementation. Is that correct?
Yes. Yep. I use all the things. I was a nutritionist before becoming a doctor, so nutrition is a huge part of what I do. I love food. I love cooking. And I will say that I love
Dr. Angela, right? Like I heard, and you can correct me if I'm wrong, but I think I heard somewhere that like physicians get 2 hours of nutrition training or some crazy like low number, which is fantastic. And what, part of the value that you bring to women that you're serving, because you deeply understand it.
Mm-hmm. Yes. And food is the foundation of health. We're feeding ourselves on a daily basis. And so we might as well just be flooding the body with nutrients that are going to be supporting fertility. And so we talk a lot about that. And I will also say, because a lot of women in the fertility world, there's so much information about, restrictive dieting and low calorie diets and all this, and particularly with PCOS, because so many women are told they just have to lose weight. And that is the ultimate gateway to motherhood. And that's not my approach at all. My approach comes from creating a nourishing and sustainable way to eat throughout the day that is focused on your fertility. How do we create this abundance of nutrients in the body? It's more about what can we add in rather than restriction and taking out.
Do you see an increase in PCOS out there? Is that something that you're seeing on the rise?
That's a good question, which is tricky to answer, honestly, because it's like, okay, is PCOS on the rise, or are we just becoming better at diagnosing it? Honestly, PCOS in the medical community is somewhat complex. There's lots of research. There's lots of doctors who are advocating for more money to be put into research for PCOS. People are still kind of talking over the diagnostic criteria, changing it a little bit. So there's some fluidity there. And so it's really, are we seeing a rise, or is it a change in how we're diagnosing it?
Yeah, that's an interesting question. And do you think some of this is environmental? Because it seems to me that so much conversation is happening right now about, estrogens in our water, our processed foods, glyphosate everywhere. Like, do you think this has an impact on it as well?
Absolutely. I wouldn't say that it's the underlying cause for everyone, but detox is one important step in my PCOS fertility protocol. So I am talking about detox, about the impact of environmental toxins, and then getting those out of the body, what that looks like for every one of my patients. And that's a different level for everyone. Unfortunately, we live in this world where we are surrounded by toxins on a daily basis through, like you were saying, water supply, air, cosmetics, lotions, the list goes on. And, I'm not here to bring anyone down, but it's important to understand, okay, number one, yeah, we've got this all around us. And then number two, guess what? You have this innate detox system in the body that sometimes gets a little sluggish. And then when it gets sluggish, then that then shows up in the body as, the classic elevated testosterone, low progesterone, infertility issues for a variety of reasons, or in a variety of ways. And so, yes, that absolutely has to be identified to say, let's take some toxin, let's figure out what environmental toxins are a part of your life right now, how to get them out, and, what products to exchange in. And then also how to support that detox system in your body. So then you're moving things through to then help with hormones and ovulation and just setting your body up for baby making.
Yeah, I think that's so beautiful. And I also like that you're setting a standard with your patients that, like, hey, we might need to slow down a little bit in order to speed up. And I think that, it really encouraging women to, like, hey, this is time well spent. Yes, it may take a few months, maybe longer, to address these issues, but it is well worth it. And I love that shift in the conversation because, it's hard in an environment where we're so used to, fast moving social media and instant gratification and same day delivery from Amazon, all of these things. Everyone's looking for this very quick solution. But I think that in order to get to the root cause, you do need to slow down a little bit. And I think it's also kind of really encouraging women to see this as true self-care. Like, because everything that you've been saying is really like, you're not broken, you're not messed up, you can trust your body. Like, but that also requires us to be willing to slow down. And it's deeply feminine. Dr. Angela. Like it's
I
really
love how you threw that in there. Yes, it is, because we are so programmed to just want that one quick fix. And oh my gosh, like my heart goes out to these women. I mean, fertility is a heartbreaking journey. Like if I had a one quick fix, I would love to give that out. But yes, like slowing down and really listening to your body, because this highly driven, very stressful day-to-day environment that most of us live in is then impacting hormones. And it's a revolutionary act to take that slowness to really get in touch with that feminine side. And that, that's exactly what we're doing, right? Is we are reconnecting with the body's monthly rhythm, right? That intrinsically feminine side of us. And, so with PCOS, having irregular cycles is one of the classic symptoms. So many women struggle with this. And a big part of the work that I do with women is to help remind their bodies of that natural rhythm. And so it's getting in touch with that feminine rhythm of, the hormones that estrogen is the dominant hormone in the first half of the cycle. After ovulation, it switches to progesterone. And there are ways to be reminding the body of that feminine cycle, even if you don't have a regular period, a regular, 28-day cycle. I'm using quotation marks because not everyone has that. But it's very much getting back in touch with that feminine side of things to be supporting this rhythm that internally our hormones want to be doing.
Well, and I love that you pointed it out, like the 28 quote unquote day cycle. And it honors the fact that not everybody has that. And that it's okay. Cause like, I'll hear women all the time, oh my goodness, my period's 30 days. And, and it's like, just because you're, like 2 days off this, what's quote unquote normal, like that's just normal for you.
Mm-hmm. There's so many other markers that you need to know if you have a fertile cycle.
Yeah.
You want to be in touch with what's going on mid-cycle, your cervical mucus, your temperature change, your LH spike if you're doing, LH strips, and using all those markers of ovulation, that's way more important than the length of your cycle. Sure, at some point, like we know, 50-day cycle was most likely not one that was fertile. But yeah, there's a much wider variance in a normal cycle than most women know. And I have to do a lot of education about that. It's like, okay, yes, you had a 35-day cycle, but you're tracking your temperature, you're tracking, with a couple of different ovulation trackers, everything's showing you positive. And these body signs like cervical mucus have all increased like that. You just had a very fertile cycle, and that's exciting. We celebrate. But yes, there's a lot of education that needs to be done to say, hey, it doesn't have to be 28 days.
And I've got to ask, are there any like anonymized stories of your patients that is there anything, that you've experienced over the years that just lit you up that were like, oh my goodness, this is why I do what I do? If you would love to share, a couple of those, that would be awesome. I really want women that are listening to take away not only that you can address these issues, and there is light at the end of the tunnel. I've personally seen it, but I think, hearing some from you might be really interesting.
Absolutely. Yes. Well, I will say first, so a lot of women are told that it's not possible to get regular cycles without birth control on PCOS. And I will say that I see this all the time. Women coming in, irregular cycles, they're not ovulating. And within a month of working with me, we are able to get them to have positive ovulation tests. And, I was just talking with someone earlier today. It was like, or two people who were just like, guess what? This is the first cycle that I have ovulated, that I've gotten these positive ovulation tests. And so it is possible to ovulate naturally and to get regular periods with PCOS. And it can actually be faster than you might think. So that's really exciting. And then, I'll tell you, different story of, someone who had been trying to get pregnant for 6 years before coming to see me. She was told that IVF was her only answer. She had a consultation with the IVF center, but just, was feeling like not ready. It wasn't right for her at that time, and really wanted to get to the root cause. So she started working with me. And based on what was coming up from her, I said, it's 6 months is going to be like a good timeline for you. Okay. Which is, after trying for years, 6 months can feel long.
Yeah.
But she was dedicated, to her journey. And so was going through this, and we talked about how there would be, an increased risk of miscarriage just based on some things we were doing with her. And she did see that miscarriage happen. For her, honestly, for her, she was saying that it was a sign that she could do it, that her body was able to get pregnant, because she had not had any positive pregnancy tests over the previous six and a half years now. And that next cycle, fertile cycle again, and she was pregnant and now has a healthy baby. Yeah. Yeah.
It's so good to hear that. It's, because some women just think that IVF is the only answer. And certainly it's a powerful tool. It's a great tool. It's there to support you. But there are some women that are just like, I'm not feeling it.
Yeah.
And it's so good that, you're demonstrating through evidence that women have options, and that if they give themselves the opportunity to think about this differently, then they can avail themselves to those options. I love that, Dr. Angela. This is so exciting. It's so exciting for women to hear this. And so I would love it if you would share how women can best get a hold of you. Tell us a little bit about that. And I'll certainly put links in the show notes for all this, but how can women best get in touch with you and your work?
Yeah, if you are listening and you have PCOS and you are tired of getting this dismissive information from your other doctor and you're like, I need to get to the root cause and I am ready for this, then you need to head over to drangelapotter.com/PCOS. That is a free call with me where we're going to talk about what's been coming up with your specific journey. And I will help you to identify what are these things that are keeping you stuck? What are these missing links? And then I will share with you the number one most important next step you can take in order to start turning around your fertility and start getting to that root cause and moving towards this optimal fertility health.
Oh, that's awesome. And that's like for women all over the world. If women want to get in touch with you. Okay, awesome.
Yeah. So right now it's for the US only.
Oh, okay. Okay. Yeah, we have a global audience, but I have a feeling people will want to get in contact with you regardless. But yeah.
Okay. So I'll say for, people who are outside of the US, then come listen to my podcast, and Roseanne is on there, the PCOS Fertility Health Podcast. Yes. Yeah. Oh, and so, that's a perfect resource for you.
That's awesome. Well, thank you so much, Dr. Angela, for coming on, and thank you so much for being this delightful disruptor in the world, really encouraging and educating women to take their own authority on this journey and to not let the label of PCOS stop them, and let it really be more of a beginning of a new path on their health journey. So I'm so grateful for you. It's always a delight, and it's so fantastic that you're out in the world doing what you do. So thank you so much.
Oh, thank you, Roseanne. Thank you for this amazing community that you have and for having me on here. It's such a pleasure.
Love this episode of the Fearlessly Fertile podcast? Subscribe now and leave an awesome review. Remember, the desire in your heart to be a mom is there because it was meant for you. When it comes to your dreams, keep saying hell yes.